Dear students, welcome to R.A.T.S. Racing Against Time for Students in Pathology. The topic for the day shall be spread of tumor. In fact, the second topic in neoplasia, and the importance of it is given in the enclosure on the screen. Generally, I start with the case history, but this is also similar and interesting. The gentleman that you see on the screen is R.A.T.S. And what he discovered was that he was having a malignancy. He noticed an inflammation in a blood vessel, and this particular sign he had earlier discovered, and it was called as Trousseau's sign. And he identified it to have been a migratory thrombophlebitis due to DIC or disseminated intravascular coagulation. And it turned out to be called a Trousseau's syndrome. What it is when he sees, he finds that there is some kind of a swelling and a clotting in one part of the arterial tree. It disappears and then reappears elsewhere. That is why it is called as migratory thrombophlebitis. And this is his bust at the Academic National Museum of Medicine. Coming to the topic proper, these are the terms that we should remember. The most definite demarcating terms between benign and malignant, which we had seen earlier, will be invasion. It can be either a capsular invasion or a vascular invasion. These are the most definite criteria. And of course, metastasis. Enlargement of the tumor, expansion of it with intact capsule, compressing the surrounding tissue, etc., are not signs of malignancy. It can happen in a benign tumor as well. Now, coming back to the routes of spread of tumors, we should think of the following subheadings. I've earlier told you, think of the subheadings will take you to the answer. And these are all the different modes of spread, which we shall be seeing in the subsequent projections. Incidentally, I am seeing a tumor of the thyroid on the screen, and this is a normal thyroid, and this is the end of the tumor. This is the tumor proper. This is a capsule as such, which appears to be intact. So it is a case of an adenoma or a benign tumor of the thyroid. Direct spread. This is supposed to be one of the most common and the first modes of spread of tumors. I find that there is a fungating cauliflower-like growth that has grown from the larynx into all the adjoining tissues. There is a breach of the capsule or the pseudocapsule. It infiltrates into the adjoining tissue. There is a rapid increase in size, and there can also be adhesion or perforation of the surrounding tissues. It is applicable to all malignant tumors. So these are general features. The tumor enlarges, it breaches a capsule, it becomes adherent to the surrounding tissues, it can penetrate, it can perforate, there can be a fistula, etc. Laryngeal carcinoma is one example. Similarly, we find that a tumor of the upper esophagus can penetrate into the trachea. The next mode of spread is the vascular spread. This is important. Let us see how we can explain it. In any tumor, you find that there are lakhs and lakhs of cells. And if each of the cell is going to multiply and spread, you find that the body of the patient will be covered with tumor cells in no time. On the contrary, we find that there is only one particular group of cells that is capable of multiplying. All the others have got some property each. For example, maintaining the nature of the tissue differentiation can be there, increase in size, secretion, etc. can be different properties. But only a one small group will be having the property of breaching and penetration. Secondly, I find that there is a basement membrane. The basement membrane is supposed to be a limiting membrane for any of the tumor, which is crossed. And this is the connective tissue. And finally, there is a blood vessel. When I say blood vessel, again there is a basement membrane, and lining the blood vessel, there will be the vascular endothelium. The tumor cells are traversing all this, and then they are going into the lumen proper. See what is happening. I'm transferring this picture over here. It is getting adjoined to the cells of the blood vessel. So there can be the inflammatory cells such as lymphocytes, or there can be platelets as such. This is more important. Platelets, fibrin, etc. they form a clot within. And so this forms a mass which is carried downstream. Which is carried downstream, it gets lodged at a site different from its origin. So this is a typical example of a tumor embolus. And after having been lodged at a particular site, the cells breach the endothelium, the basement membrane, and they infiltrate the region that is there. So this is a fibrocollagenous tissue, and to support them, they need blood vessels. This is called neovascularization. So I hope this is easy for you people to remember. We shall come back to it. See this. So this is a clone of cells or a group of cells which are having a peculiar property. So there is invasion. And it forms a metastasis. A small subclone of it can penetrate it. This is a matrix or the connective tissue which is crossed, the basement membrane is crossed, and the endothelium. And finally, it goes into the vascular lumen, which is called as intravasation. There is a tumor embolus. It is adherent to the endothelium lower down the stream, and there is adhesion. Finally, it is extravasated, or it exits from that region and gets lodged elsewhere, which is a metastasis. So this is the mode of spread of the tumor. I would like you people to kindly remember and draw this diagram, which shall form the fulcrum of your answer. And look at this one. It is a live photograph, micro photograph rather. This is a tumor. There is a capsule over here, and then there is an invasion. Secondly, there is a blood vessel. Externally, there is a blood vessel, and that is showing a tumor embolus. So this is a typical example of vascular invasion, classical of follicular carcinoma and other tumors. This is yet another example, the renal cell carcinoma. I can make out the kidney by means of the rainiform shape. And here there is a normal corticomedullary differentiation. Normal parenchyma is seen, whereas the upper pole and most of the kidney is replaced with tumor. It has got various appearances, so there is areas of hemorrhage, necrosis, etc. But that is not important. Look at this structure. It is a renal vein, or the vein that leads from the kidney into the inferior vena cava. So the renal vein, and it leads to the inferior vena cava, which is filled with tumor cells. From there, it goes to the right side of the heart in a solid snake-like column. So this is one mode of spread of tumors which we shall remember. Again, the same in a beautiful diagrammatic sketch which you people can draw. So there is a tumor over here, and the tumor spreads within the kidney, and it invades the vasculature. This is a renal vein, a higher magnification of it, which is showing the tumor cells within the lumen. And this will get lodged in the inferior vena cava, go up to the right side of the heart, up to the right atrium or ventricle in a solid snake-like manner. This particular diagram I would like you people to draw. And this, of course, it is not, I may labeled it purposely as flight of ideas. Let us see what is happening. But I do not know anything about this particular helicopter, but I'm finding that there are certain structures that are here. And finally, this is going to land somewhere. So this particular column alone we will concentrate on. Why am I showing this? It is analogous to something else. So this is a diagrammatic picture of the tumor cells. So these are all the tumor cells, and in between the tumor cells normally there is adhesion which is lost. So there is a loss of intercellular adhesions. Also you find that there will be some receptors at the surface of the cells. And these tumor cells also secrete some material called as laminin, etc. So what happens is there is an attachment of the tumor cells. And what happens gradually later on is this gets attached to receptors on the surface of the basement membrane, and the tumor cells get lodged. Just as the helicopter, it gets landed at a particular site. After this, there is a signal. So this is mainly made up of collagen, type 4 collagen, and these are laminin receptors, and these are laminins on the tumor cells which get attached to the receptor. The moment they get attached, you find the tumor cells start secreting a lot of these enzymes called as collagenase, protease, etc. And this collagenase starts digesting the collagen that is surrounding the tumor cells. And look at this one, the collagen is mostly dissolved and the tumor cell is seen traversing the entire collagen. So this is the mechanism. I'm repeating it again. You find in the first slide, there is a kind of loosening of the intercellular junctions. Second one is there is an attachment of the laminin to the laminin receptors in the collagen or the basement membrane. And then there is a secretion of the collagenase which starts digesting the collagen. And finally, there is the traversing of the collagen by means of the tumor cells. And these are the terms which I would like you people to kindly remember. All this you should write in your answer on the vascular spread of tumors. Next will be the lymphatic spread of tumors. In a lymph node, for anything, I should know the structure first. So the lymph node is also somewhat rainiform or bean shaped, and I find that there are some lymphoid follicles. And these are all the afferent lymphatics. Afferent lymphatics, which mean they drain into the lymph node. And there will be one lymphatic which drains away from the lymph node, which is called the efferent lymphatic. And then this is the capsule. So these things I should remember: follicles, and then afferent lymphatics, efferent lymphatics. The same thing is over here. There are the afferent lymphatics which drain, and these are all the lymphoid follicles, and this is the efferent lymphatic vessels. This particular region that I'm showing is called the subcapsular sinusoid. Below the capsule, there is a sinusoidal space, and then there is a network of these sinusoids. Initially, I find that okay, this is a mode of spread, just identify it. So there is a group of tumor cells over here, and these tumor cells are getting drained by means of the lymphatics. There is one main guard in each region that is called the sentinel. Sentinel means guarding. That is a guarding lymph node which is first affected. After that, you find that there will be a second node of filter, which is there, the second lymph node, and then there can be the third tier of lymph nodes. So there are multiple groups of these lymph nodes which are affected in the spread of tumors. Again, the vein over here will concentrate only on the lymphatics. One is a sentinel, then there is a second tier, then there is a third tier of lymph nodes. So in some cases, due to what reason we do not know, the first node will not be affected, and then you find that it goes to the second group of lymph nodes. So it skips this particular lymph node. This is called a skip metastasis. And in some cases, again, it is not able to spread in this direction. It goes backward, which is called a retrograde spread. Usually a spread is progressive. Sometimes it can skip, sometimes it can become progressive. Why it happens is, supposing there is a lot of fibrous tissue around the lymph node, the tumor cells are not able to penetrate, so it becomes a kind of bypass, and then you have this skip metastasis. So this is the diagram I wanted you people to explain. So this is a lymph node over here. I am seeing the lymphoid follicles and this is the capsule. And initially the subcapsular sinusoids are involved. Later on I find that all the sinusoidal spaces will become involved with the tumor cells. Finally, sometimes the entire node also can be replaced. And this incidentally is an embolus. This is a lymphatic channel which is normally not seen, but this is showing tumor. So this is a lymphatic embolus in a case of cancer. Another mode of spread will be the transcoelomic spread. Transcoelomic means across body cavities, across the peritoneum, sometimes across the thorax, etc. And one such one is called the Krukenberg's tumor. What is the Krukenberg's tumor? In this, both the ovaries are involved. So look at this particular picture. It is a uterus and these are the ovaries. And both the ovaries are enlarged and they are bilateral, not symmetrical, but I'm also able to see some bubbles on the top. So bilateral mucin secreting metastatic adenocarcinoma is called the Krukenberg's tumor. And the primary can be from the GAT, gallbladder, breast, etc. People used to say that it is because of the gravitational fall that the tumors get collected in the ovaries. But some books say that it is because of the lymphatics also. This particular diagram you people can draw. A gastric carcinoma over here, malignant cells are simply falling and they get accumulated in the ovaries, which is a bilateral mucin secreting adenocarcinoma of the ovary, which is called the Krukenberg's tumor. This can be a question for you. And this is what we see microscopically. So I find that the cells are all large. They are being filled with somewhat pale material and the nucleus is being pushed to the periphery. It resembles this. This is supposed to be a signet ring. In this one, I find that there is a bulge and then the rest of it is empty space. That is what we are seeing over here. The signet ring is supposed to be the ring of a king and he will not be signing the papers, he'll be only putting his emblem on it. So that is called the signet ring cell. It can be stained with, the material can be stained with either PAS, periodic acid strip, or the music carmine. I would advise you to kindly go to my explanation in the game. Metastasis. It can also be, you find that some organs are very commonly involved in metastasis. The picture here, it shows liver, which is having multiple metastases and nodules are of varying sizes, etc. My question here is, why is the liver more commonly involved? Is there any other organ which is again more commonly involved in metastasis? If so, why? The liver is commonly involved because it has got a dual circulation. It has got a systemic circulation and a portal circulation. Similarly, the lungs are also involved, and because of that, there is increased metastasis. In that case, there will be the pulmonary circulation and the systemic circulation. Because of the increased vasculature and dual circulation, there will be metastasis. One other interesting mode of spread shall be perineural. Look at this particular picture. It will be a little complex, but these are all tumor cells. These are all tumor cells over here, and this is a nerve bundle. This is another nerve bundle. But see what is happening. The blue arrow is the nerve bundle over here, and around that I am finding an accumulation of the tumor cells. This is what we call as perineural spread. People earlier thought it was by capillary action. There is a gap in this region and the tumor cells permeate it. So it is called as perineural. But later on, there was another school of thought that felt there are some lymphatics over here which is aiding the spread. Whatever said and done, this perineural mode of spread is common in some tumors such as the prostatic carcinoma or the pancreatic adenocarcinoma. And these are supposed to be the mechanisms for it. One other mode of spread, last but not the least, is iatrogenic. Iatrogenic, the word means physician induced. So look at this one. Obviously, a biopsy is being done. If you very carefully see that there is a needle which has been magnified over here, it is being inserted and a biopsy of a tissue is being taken. But what they say is when a biopsy is being taken, it will be done under ultrasound guidance or any other mode of radio diagnosis. And when they take a correct diagnosis also, correct biopsy also, there can be implantation of the cells either at the subcutaneous site or in the skin. So this is called as iatrogenic, another mode of spread. So I would like you people to kindly recollect all the methods of spread, including direct, vascular, lymphatic, iatrogenic, perineural mode of spread, transcelomic, the Krukenberg spread, mode of spread, etc. All of these are questions for you people, and this itself is an essay question for you. Hope you people are able to answer it. This yes.